and welcome to the Senior Advocate Caregiving Series sponsored by Commonwealth Assisted Living. This series is made up of 5 short videos to help families understand and communicate with their loved ones who may have dementia. My name is Stephanie Smith. I'm here with Jeff Gruber, who is the Director of Memory Care at Commonwealth Assisted Living. Today we will be discussing understanding and recognizing dementia. Welcome, Jeff.
Good morning, Stephanie.
Jeff, can you tell us about dementia and how does it relate to Alzheimer's disease?
Stephanie, dementia is an umbrella term that is commonly used in the industry which describes a cluster of symptoms. It is not a specific disease, however. When you think about dementia, there is reversible and non-reversible. The non-reversible dementia, which you might be familiar with, obviously the most common diagnosis would be Alzheimer's, which is about 66% of all forms of dementia. Others include Lewy body, multi-infarct, Parkinsonian, and then frontotemporal.
For someone with dementia, are there signs and symptoms that we should recognize?
There are 4 symptoms that are pretty common under the dementia umbrella, and they would begin with having short-term memory loss, which also leads into poor judgment, loss of reasoning, and then loss of critical thinking skills. And unfortunately, 1 in 3 Americans do know someone who has been affected with some form of dementia.
Jeff, you've probably heard the term senility. There is an assumption out there that as people age, they will automatically become more forgetful. Is memory loss part of the natural aging progression?
Stephanie, it is not. As our loved ones do age, it should not be assumed that they will fall into this category of having some form of dementia diagnosis. Just because we age does not mean we will have some type of dementia diagnosis. We all have forms or days where we are forgetful. We forget where we put our keys, we forget our shopping list, but it should not be assumed that as we age that we're going to have a diagnosis of dementia.
And what would be the process for somebody to be diagnosed with dementia?
It is best if you know your family history, obviously, and have a strong relationship with your physician. If you begin to have some of those symptoms that we mentioned earlier on, it is best to get to your family physician, and then he has several tests that he can perform to narrow down that diagnosis. One of the most common ones would be a Mentimental exam.
Are there pharmaceutical treatments available, and if so, how effective are they?
For early onset, Aricept is a very commonly used medication, but as I mentioned earlier, with us not having a cure for Alzheimer's, medications such as Aricept, Namenda, and Exelon can only be used temporarily.
Are there other forms of treatment if somebody does not want to take medication to actually treat some of the signs and symptoms?
There are. Once again, knowing your loved one's history can help them to adjust to their environment. Having a routine established and then knowing, once again, the triggers that set off periods of anxiety or having some emotional distress is helpful if you know what their background is to avoid that.
Thank you very much, Jeff. That will actually lead us right into our next video, which will be about utilizing life experiences to help navigate dementia. I'm Stephanie Smith. This is Jeff Gruber. Thank you for joining us today.